income of less than $30,000 per year are 1.9 times as likely to have a reported COVID-19 case, but 2.7 times as likely to be hospitalized for COVID-19 compared to the rest of the population. So while COVID-19 is a threat to everyone, it is plainly imposing real and disproportionate burdens on racialized communities and lower income groups. It is important to acknowledge how people's living and working conditions are contributing to these inequities. Evidence shows that racialized and immigrant communities are more likely to work in frontline and essential work, like healthcare and supportive services, putting them at higher risk for COVID-19. Many workers in lower wage frontline jobs do not get paid if they call in sick. This is a significant barrier to our pandemic management efforts and reinforces the need for effective income supports for working people suffering from COVID-19, in particular, paid sick days. But any measure that makes it easier for people to remain safely in employment during the pandemic, or to stay home and apart from others when sick, benefits them and everyone else. It is, in my view, an investment with the capacity to generate significant returns in many ways. I also want to report to you today that for the first time in many months, Toronto's effective reproductive number is below 1 at 0.86. This means that overall, each new case of COVID-19 is resulting in less than one additional new infection. Practically speaking, it means that we have a slight advantage over the virus, rather than the virus having the advantage over us. Additionally, there has been a further decline in the 7-day new case moving average, which is now at 730, down from 772 at last report. This said, we need to see a consistent pattern of improving indicators before we call it a trend with any kind of confidence. Of course, lower infection rates and lower case counts are what everyone hopes to see. But it is very early going and a very delicate balance. The tide has not yet turned. Staying home, limiting our interaction with people we don't live with, and keeping a safe and masked distance when we are in circumstances where that's not possible, all this remains as vital as ever. These indicators are, I hope, an incentive for all of us to redouble our focus on the self-protections that strengthen us all. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. Today is the 317th day of continuous Emergency Operations Center operations. Our EOC continues to operate, ensuring that both critical and essential services are being provided without interruption. I'm proud of every member of our team who continues to work hard each day in support of our residents. From the outset of COVID-19, our overarching incident management system priorities have remained unchanged: to save lives and prevent the spread of COVID-19 in our city, and to prevent our healthcare system from becoming overwhelmed. These priorities continue to guide all that we do in planning for and responding to COVID-19. At present, our personal protective equipment levels remain stable, and our team continues to work hard to maintain an inventory of the equipment we need each day. Based on current consumption rates, our PPE inventory levels are as follows: a 281-day supply of N95 respirators, a 1,907-day supply of surgical masks, a 102-day supply of isolation gowns, a 573-day supply of face shields, and between a 117 and 663-day supply of disposable gloves, depending on the specific model. And as you can appreciate, we require a number of sizes and styles of gloves to meet the variety of needs on the front line. At present, our emergency PPE reserve includes a further inventory of both N95 respirators and surgical masks. Based on current consumption rates, our emergency PPE reserve inventory levels are as follows: a 1,782-day supply of N95 respirators and a 2,535-day supply of surgical masks. Our emergency PPE reserve is maintained for use in the event that we are unable to maintain normal operating inventories. The province of Ontario provides the PPE required in order to operate COVID-19 immunization clinics, preventing the need for the City of Toronto to draw these items from our operating inventories. The enforcement of public health-related regulations continues to be a top priority for the City of Toronto since the outset of COVID-19. Our coordinated enforcement teams have been working diligently to enforce the regulations relating to COVID-19. The City has taken formal enforcement action 1,991 times to date. Since our last update, and as a result of violations of the Reopening Ontario Act, 6 charges were laid and 45 notices were issued against owners and operators of retail stores, personal service settings, and an automobile detailing service. Additionally, 9 charges were laid as a result of large gatherings on private property and in private residences. I thank the vast majority of residents and businesses who continue to help stop the spread of COVID-19 in our city. We also remind residents that when using parks, to practice physical distancing and to always wear a mask whenever possible and whenever physical distancing is not possible. If an amenity like a toboggan hill, playground, or dog off-leash area is crowded, please wait until there is enough space to physically distance or return at another time. And as a reminder, our outdoor rinks and our approved toboggan hills remain open. I remind you that toronto.ca/COVID-19 remains the best and most credible source of information for city residents and businesses. Thank you. I'll now invite Councillor Cressy to bring his remarks.
Well, thank you, Mayor Tory, Dr. Davila, and Chief Pegg. When it comes to this pandemic, there are some hard truths that we have to both acknowledge and confront. While all Torontonians have been affected by this pandemic, the hard truth is that some people in our city have struggled significantly more than others. 49%. Half of Toronto's cases have been people living on lower incomes. 79%. The overwhelming majority of Toronto's cases have been people of color. The truth is, COVID has exposed pre-existing inequities and challenges in our city. Precarious employment, a lack of affordable housing, access to health services. COVID didn't create these realities, but the pandemic has exposed and taken advantage of them. And so it's in that context that our task, in fact, our fundamental duty, is not simply to report on this data, but to correct these wrongs. Now, last year, our city and our Board of Health initiated Toronto's Equity Action Plan. It's a comprehensive citywide plan to protect residents hardest hit by the pandemic. In the fall, we told you about targeted measures, including making testing more accessible by repurposing city facilities and buses, and addressing testing hesitancy by funding community-based organizations to connect with residents. The Mayor has already gone through the results and the work in detail. I want to take a moment to speak to you about the work our city is doing with Toronto Community Housing. In recent months, TCHC has worked with Toronto Public Health, community agencies, and provincial healthcare partners to provide 13 pop-up testing clinics at their buildings. Significantly, TCHC has also worked to conduct 5 door-to-door testing programs at seniors' buildings experiencing outbreaks. More than 900 residents have been tested as part of this program. But here's what I want to focus on. The model developed here isn't just about bringing testing directly to people's doors. It's the outreach to encourage testing and to provide services to people so that they can safely isolate. It's this model that's innovative. So for each of these pop-up and door-to-door testing clinics, TCHC and local agencies, they went door-to-door in buildings 3 to 5 days in advance of the testing. So working in multiple languages, outreach staff made phone calls, they dropped off leaflets, and they knocked on doors to connect with residents first. And they did this to ensure that people were aware of the on-site testing clinics to come, but also to connect those residents to the services that they need to safely isolate after the tests. Services like food hamper deliveries, prescription drug drop-offs, access to digital devices and Wi-Fi. And after the fact, TCHC staff conduct additional follow-up wellness checks with these residents to provide additional support they may need. You know, I labor on this point because this is the model we've been talking about for months. It's about making testing more accessible in hard-hit communities, but also providing the wraparound outreach and services to not only encourage people to get tested, but to support them to isolate safely afterwards. And so these actions we've described today, they're not the end point. We're nowhere close to finished yet. And even as the promise of a vaccine is on the horizon, we will continue to scale up, do more, and innovate further. As the chair of the Board of Health, I can tell you that tackling inequity and protecting our most vulnerable, it's both the right thing to do, and it's also just good health policy. We do this work because every resident of our city, every single resident, no matter where you live, where you work, how much money you make, every single resident deserves the protection they need from this devastating virus. We're not going to stop, and that's what it means to be all in this together. With that, I'll turn it over to Brad Ross to open up the floor for questions.
Thank you very much, Councillor. We will go to questions now. Just a reminder to please unmute yourself, and we'll go first to Mark McAllister from City News. Mark, go ahead, please.
Thank you very much, and congratulations on the outreach work that you have been doing. A quick question related to that. It's one thing to reach a number of people. It's another thing to get those people to those testing sites and getting a response rate. How successful would you say you have been or not been?
So, Mark, I don't have the specific numbers in front of me, but we certainly do know that bringing tests to people so that they have better access and making sure that they have, a fulsome awareness of the opportunity and fulsome awareness of all the services and benefits that are available to them to address any concerns that they may have around implications of testing certainly does bring up the levels of testing and the levels of acceptance for those offers of help, support, and other opportunities. I don't know if you have specific numbers there with you, Councillor Cressy.
Well, Mark, I'll just draw your attention to the door-to-door testing that was done last week. This was done at a TCHC seniors building in North York. And so 3 to 5 days in advance of the testing, they went and knocked on doors and delivered multilingual outreach letters. The end result was on the day of testing, 220 residents were tested out of the building that has 266 residents. That's an outstanding result. And I think in a climate where we see that not only do people need testing, but in many cases people are fearful of testing. If I test positive, will I be able to pay my rent? If I test positive, how will I isolate and get food or prescription drugs I rely on? That outreach in advance helps to ease people's concerns and to provide the necessary supports. And so those numbers there, 220 out of a building of 266 people, I think shows just last week that this new model works.
Thank you for that. A question to Mayor Tory. I know, Mr. Mayor, you did not get a question related to this, and you did speak to it at the end of your availability yesterday. So I'll pose a question to you this time about the Foundry site in the West Donlands. Councillor Kristen Wong-Tam was down on the site today, spoke about how community lawyers are now getting involved, but she also referenced how city solicitors are also getting involved and have supported the application in the course to try and get this demolition stopped. She said it's not just the fight of the community, but it's also a fight that will be taken up by City Council and specifically said by you as well. Can you comment on the fact that this is now being taken to the courts and your role in that?
Well, I would just say that I think, in fact, the city may be a respondent in this application simply because there's a number of laws that the plaintiffs, as I understand it, will be asking the court whether they should form part of the basis upon which an injunction would be issued to stop the demolition. In our own case, we certainly are very supportive of the efforts that are going to be made on that site to create more affordable housing. That's a very good thing for the city. But as I've said, when you are developing, doesn't matter who's developing it, whether it's the province or an individual developer, it doesn't matter whose land it is, when you are putting new developments into an existing area, you are impacting existing neighborhoods in some way, and consultation is important on many subjects, including, but certainly not limited to heritage aspects. And so we think it would be better for there to be that consultation for the studies that the province says it has undertaken, I'm sure they have, to be made public so everybody can see them. And so the court process will play itself out. There are probably ways in which some of this could be resolved outside of the court, which is always better. But we've made our views known. I've made my views known. And we'll have to see what transpires, either in or outside of the courts.
Okay, thank you very much. We'll go next to John Chidley-Hill from the Canadian Press. Go ahead, John.
Good afternoon, everyone. My first question is for Mayor Tory. Mr. Mayor, I understand that you spoke with Pfizer executives about the production issues they've had with their COVID-19 vaccine. I was wondering if you could tell us what that conversation was like, and if you got any reassurances from them that production is going to catch up, given that they're falling behind.
Well, I will not specify who I talked to. I think the best way to go about these kinds of conversations is to make your case as a Canadian, which I did as the mayor of the fourth largest city in the country, and to try and make Canada's case. These are individuals that I happen to come to know in my life and my career prior to being mayor. And I will just say to you that I tried to make Canada's case, in a determined, thoughtful way. And I've kept the government of Canada fully apprised of the conversations I've been having, because I'm trying to help the country's efforts to try and see if we can't get more supply. And I can't tell you what results my interventions or anybody else's will have, but I've tried to do it in a positive and constructive way, because I think that's the best way to go about trying to do business on something as sensitive as this.
As a follow-up to both you and Dr. Davila, how frustrating is it to have the city's vaccination programs have to be put on hold for an indefinite period of time as the city and the province and the country wait for the next shipment of vaccines from Pfizer?
Well, I'll start off, and Dr. Davila, of course, we can deal with the health-related aspects and any other aspect, but she can certainly deal with the health part, which I really can't. I will just say to you, I think in terms of the sort of psychology of the city, the fact that people view the vaccines as such a foundation for hope, the fact that it really does present us in a very practical way with the ability to move beyond the kind of lockdown, phase that we've been in seemingly for a long time now. And so in that sense, it's very frustrating. It's frustrating for the business people who want to get back to business. It's frustrating for people who want to get back to work. It's frustrating for kids who want to get back to school. And it all, impacts on that. And that's why, I've been trying to help in any way that I can to see if we can try to find some help in this regard. Dr. Davila can perhaps certainly can address better than I can the health, I'll call it the health frustrations or the health impact that this has.
Well, if I can add further to that, clearly I think we're all frustrated because we were quite hopeful and, as you can well imagine, eager to get on with an immunization program, recognizing that, we now have these vaccines. They've been approved for use. They're safe and effective, and they are, an incredible tool, if you will, in our toolkit against COVID-19. And so many of us have been working so hard at, trying to respond to this pandemic. We were very excited to have this new tool in our toolkit available for us to use, and certainly having it slowed down and having the change in course is not what we wanted, but We expect that there will be eventually vaccine coming available, and that we will do our very best. So we're taking advantage of the time that is available to us now to ensure that everything is as ready as it can be, such that when the moment arrives that vaccine is more available and the supply is no longer a challenge, and we hope that that day comes sooner rather than later, but we'd like to make sure that we're as ready as possible. But in the meantime, we do know that it's distance, distance, and distance that makes the difference. We know what the self-protection measures are. I know it's frustrating for people, but we ask people to hang on. We are seeing, the benefits, starting to see the benefits of our collective action together. The more we can focus on those self-protection measures, the stronger we will be as a city, and the more ready we will be for that day when the vaccines are available.
Okay, thank you very much. We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead.
Hi, thanks for this. The question for either Dr. Davila or Mayor Tory, I guess maybe Dr. Davila first, is we're now in a 28-day lockdown that may be extended because of the high COVID rates. Now that we're seeing some decrease, can you talk about how that relates? What do we need to see that we could think about ending the current lockdown and reopening again? How far away from that are we? If this isn't a trend, what do we need to see?
So, David, I would start off first with that we do want to see sustained trends. We are hopeful when we see indications of improvement. But just as is the case with any, clinical or medical situation, you take, specific signs of improvement, with some caution. We know how very delicate a balance this is. And certainly, as there are new variants of concern with increased transmissibility as one of the characteristics, I think we need to continue to have a great deal of caution as we move forward, and we need to be very vigilant as a community, each and every one of us, in respect of those self-protection measures. I can't say enough how much it continues to be so important that people really limit their interactions exclusively to those with whom they live. Maintain that safe distance and a masked distance at that when you're out and about doing those essential activities that we all need to do, whether it's groceries or healthcare or getting some exercise. All those self-protection measures are what will see us through so that we can get to that point where we can, say that we're seeing real trends in the right direction, and hopefully aided and abetted by a more available and flowing supply of vaccines, so that we can add that as part of our self-protection measures.
David, I'll just say this. How many people out there have prescription bottles that have some pills left in the bottom, and they're now in a drawer in a cupboard somewhere, and yet the bottle says right on it, please take these until they're finished. And I think that our inclination as human beings often is to sort of say that as soon as things sort of feel slightly better, that you stop doing the things that, including taking the pills that got you to feeling better. And so again, the prescription here, keep your distance. Don't socialize with people that you don't live with. Wash your hands, wear a mask, avoid crowd scenes, and all the rest that we've been saying. And I think now is going to be the most important time of all for us, if there are just glimmers of hope on the horizon, to see that through and not start making predictions about what day things are going to open or close, but rather just say, let's stay the course and let's get this done. And, I think that there's every reason to believe we can get it done, but that's what it's going to take, is finishing the prescription.
Thank you. And then my follow-up, I guess, is for Mayor Tory. Premier Ford kind of came out swinging against Pfizer, said that, he doesn't accept the excuse that they need to stop production for a while to retool a plant, that it's not acceptable. You're having, so it sounds like, more sort of quiet, maybe constructive. I'm not sure the tone. I obviously don't know what you said to the business people But can you talk about that? Is it helpful to kind of be yelling at Pfizer, or what approach should you be taking? Because it seems like you're taking slightly different tactics.
Everybody has to, make their own choices about that. I just felt that making the case as to why it was not only unfair and not only something that didn't seem to make any sense, but rather it was also it was going to, have an adverse effect on some of the efforts we had begun with respect to inoculating people in long-term care and so on, with the second dose to come and all that kind of thing. And I think it was important because people don't necessarily focus in other parts of the world on what's going on in Toronto or Canada or Ontario. I think that you also have to understand there are business challenges that these people face. If you think of the very challenge of producing billions of doses of this vaccine, there are going to be things that happen in the course of that, just as there are going to be things that happen to us in the course of rolling those things out to individual people in their arms. And so I've tried to, as I say, make Canada's case. I know the Prime Minister is completely engaged in this issue and is making all kinds of efforts to, again, put Canada's case and to understand some of the business challenges that these companies face. And you just have to hope that the combination of these efforts will produce some kind of positive result for our country. And we'll see.
All right, thank you. We'll go next to Lucas Meyer from News Talk 1010. Hi, Lucas. Go ahead, please.
Thank you, Brad, and congratulations, Chief Ed. Congratulations. I guess the Mayor Tory and Dr. Davila, if you want to get in on this as well. Obviously, a lot of talk there on the testing efforts early. We've been kind of re-looking at rapid tests, and the ministry tells us that they're looking at an 8-week pilot project for employers in healthcare, frontline, congregate settings, manufacturing, warehousing, supply chain, etc. What do you want to see in terms of a city strategy, in terms of a rapid testing approach? What are some things, some examples of things that you want to see, since this vaccine thing is kind of on pause, if you will?
So, Lucas, why don't I start off? I think that for us here at the city, and in Toronto Public Health in particular, we have actually had many conversations with people and advocated for the potential use of rapid testing in particular settings. So one particular setting, and we were actively working on a pilot on this in the fall, was within schools. So, I think that when you look at the modalities of testing that are available, certainly we know that the tests that most of us are familiar with, that PCR test that you get done at an assessment center or perhaps through a pop-up testing center or mobile testing center, is very, very sensitive, which is great. It makes it, an excellent tool to help us diagnose cases of COVID-19. When we talk about rapid testing, you do trade off a little bit. I mean, sensitivity is not as good, and ideally you make up for it in other characteristics, whether it is simpler to administer, more readily available to people, perhaps even less expensive. So it's a question of trying to use the various testing methods that you have available to you in the best way possible. So we have thus far undertaken some pilot efforts with rapid testing in schools in particular, but I can imagine that there might be other places where it could be deployed very usefully. For example, within the context of long-term care homes and visitors, perhaps, and in certain workplaces. Again, it all depends on the unique circumstances of the facility or place and the population that you're seeking to test, and making sure that you have all the protocols in place. But I think this is an example of using the available technology and finding the way to deploy those new technologies as smartly as possible, as efficiently as possible, so that we get to diagnosis sooner rather than later and can help people get to treatment as needed.